Hi, I'm Mark Whitlock with Arlington Dental. I wanted to show you when you come in for your smile assessment, which is at no cost for you being a new patient or just a regular house patient of ours in general, we can show you from a scan how your teeth are today and what they could actually look like through Invisalign treatment. So you could get a good idea of the new shape and form of your teeth and how the puzzle pieces fit together. And I just wanted to show you a quick piece of what we do when you come in for either Invisalign or just a new patient or an even recall patient that we have as far as our smile assessment. Okay, so what this is when you come in, we scan your mouth and we can see through our virtual heat map how your teeth are hitting, or as you can see up here, how they're not hitting. And we can talk about ways to adjust that. And you can also see in real time how your teeth look, the shape of them, and how they're either in occlusion, where the puzzle pieces match up, or not.
To get the smile you've always wanted, Invis is the answer. You have a bunch of choices when it comes to straightening your teeth. Braces are common and other clear aligners are everywhere. So why is Invis the answer? Transforming smiles with more sophisticated technology and data points from more than 8 million smiles for better predictability, Invisalign is the world's most advanced clear aligner system. A specially engineered, patented material that's proven to move your teeth more precisely and more comfortably than ordinary aligners. Your treatment plan is built based on your doctor's prescription and years of research and intelligence from millions of patients. So your treatment experience is personalized to you, and only you. You don't have to make drastic changes to your lifestyle. Because Invisalign aligners are easily removable, you can still eat and drink what you want, and can even play sports without worrying about broken wires or brackets. Straightening your teeth with Invisalign is on average 5 months faster than braces. Also, studies showed that patients treated with aligners had less plaque and better periodontal health than those wearing braces. And what's more, no accidents from broken brackets or pokey wires in your mouth. For more comfort and predictability than other aligners and a faster, better experience than braces, Invis is the answer to transform your smile.
Sometimes we do what's called transillumination on old amalgam fillings. Those are the silver fillings. So they've got mercury and tin in them as well. What they do over time, I can speak from it because my tooth broke back here that it needed a crown. The old silver will start to creep, meaning expand on the tooth structure and crack it. You can't see it in an x-ray most of the time. So through a transillumination, what it is this little fluorescent light that we put on the teeth if we suspect something. And if the light does not shine through the tooth, which it should, if it sees a crack with its light, the light from the transillumination wand will actually kick back out on itself, and that part of the tooth will be blacked out. And you can then definitively see where the crack marks are. So versus you leaving my office and then in a week or two you break a tooth that we may have to just pull, you could just get a new roof on that tooth and know that it's saved and you're not losing a tooth.
There's a lot that goes into a winning smile. Superior talent, tireless commitment, and a desire to achieve the impossible, not as an individual, but as a team. It's dedicated practice and research, combined with the latest technology, coming together to create the perfect lineup. And it's years of perseverance, through opportunity and uncertainty, culminating in one final breathtaking instant. Which is why Invisalign clear aligners are now an official sponsor of the National Football League. Our two organizations have been a part of many game-changing moments, and we know the hard work that goes into each one. And as a proud sponsor of the NFL, We are committed to transforming smiles and changing lives, both on and off the field. Invisalign and the NFL. Winning smiles start here.
Do you like your teeth crooked, or does your teeth being crooked bother you? Most say no, some say yeah, some didn't even really think that they could get Invisalign being older in age, 40, 50, 60, we have patients in their 70s in Invisalign. Other than just making your smile look pretty again, the big thing for us is getting you in the right occlusion with your teeth, because if the puzzle pieces aren't matching up, you're going to wear out your teeth really quickly and cause a lot of issues, either being chipping of the teeth or needing fillings done because of bacteria getting in certain spaces because your teeth are too crooked to where you can actually floss them or even clean them with the toothbrush. It's a big thing with what we do with Invisalign. To get your teeth in the correct position saves you a ton of money in the future as far as fillings down the road, crowns, root canals, because your teeth are now lined up and the puzzle pieces work together, therefore they function better. Hi, I'm Dr. Mark Whitlock at Arlington Dental. We try and be a little different than most dental offices. There's a lot of great dentists in this town. We try and pride ourselves on just being very relaxed, very family oriented, to try and make you, our patients, feel comfortable in the dental office, because that is an extremely hard thing to do for you and for us to convey to you as you are a patient. But we do our best to make sure that it is the most relaxed place you can come to for your dental care.
Everyone knows that straight teeth give you a beautiful smile. Did you know that straighter teeth can also affect your overall health? Crooked or misaligned teeth, also known as malocclusion, affects 74% of American adults. Left untreated, crooked teeth can lead to periodontal disease and create abnormal amounts of stress on teeth and jaws, which can lead to premature wear. The effects of crooked teeth can worsen over time and may adversely affect your overall health. Common types of misalignment include crowding, spacing, deep bite, open bite, crossbite, edge-to-edge bite, and excessive overjet. Crooked teeth can affect your periodontal health because it's difficult to remove plaque and bacteria from the crowded areas. Bacteria that is not properly removed will multiply and trigger periodontal disease, which begins as gum inflammation, redness, and bleeding while brushing and flossing. If left untreated, over time, gum inflammation will progress to chronic infection, soft tissue damage, receding gums, periodontal pockets, bone loss, and eventually tooth loss. These conditions can lead to painful repair and maintenance in the future, which could amount to thousands of dollars in expense and countless hours in the dentist's chair. Problems in the oral cavity are best treated in the early stages. Crooked teeth that are left untreated can trap bacteria that damage gum tissue cells and invade blood vessels. This can cause damage to cells that line your coronary arteries, increasing your risk for heart disease, stroke, and other illness. Correctly positioning your teeth for proper alignment and function will help prevent future dental problems and make a significant difference toward a healthy mouth and keeping your teeth for life. Ask your doctor and hygienist today about Invisalign, a series of clear aligners that are custom-made to gradually move and align your teeth. And start on the road to a healthier you today. Visit Invisalign.com to find a provider near you.
Hello there, my name is Dr. Mark Whitlock with Arlington Dental, and just going to give you a little inside information on what a crown is, why you might need a crown, and what it looks like when it's restored. So over here, we have a tooth that needed a root canal, but due to the amount of decay, as you can see around here, even if it was more aggressive, you're still going to have to do a root canal. But we're going to talk about just the crown portion right now. So a crown is when a tooth gets so broken down, it needs a new roof. And it needs a new roof because if it's so broken down, if you don't get a new roof on it, you have the potential, a high potential, to eat something and that tooth cracks vertically, meaning going up this way. So once it does that, you're no longer getting a crown, you're pulling a tooth. So what that is you come in and you get numb just like you were getting numb for a filling. It's the same process. Then you take an impression, you get a temporary crown on top, come back in a few days, and then you get your permanent crown. So what it looks like is that's a little preparation. It's called a crown prep. And then you get a new roof that goes on it. And in a bigger version, looks like this. Your teeth obviously aren't this big. So once you prep a tooth down, you get rid of all the decay, all the sugar bugs, all the bacteria on the tooth to where it's a nice clean surface. It's cleaned up, it's ready to go. And once you put a new roof on, it's as if you've got a new tooth again. And done properly, this thing should last you a very long time. And from that point, you don't have to worry about any more cracks or possibly losing the tooth because it's healthy again. Just floss and brush your teeth and see us every 6 months. All right. For more information about having a consultation set up, be it to just get your teeth cleaned, or if you are in pain or may need some fillings done, or you may need a crown, come in and let's have a conversation. Let's take some pictures and see what they look like. You can see what we see and let's talk about it. You may just need a filling, but let's not crack a tooth. All right, thank you, bye.
Girl, don't do it. It's not worth it. I'm not gonna do it, girl. I was just thinking about it. I'm not gonna do it. I did it.
Invis is everything braces isn't. Eating the foods you love. No compromises. Invisalign.